Common side effects of chemotherapy in general are going to include fatigue to varying degrees, but almost everybody gets some degree of fatigue that tends to be cyclical throughout the chemotherapy cycle. So there's certain days or certain parts of a week that a patient will feel particularly tired, but then they'll feel better and bounce back later in that cycle. Hair loss is common with a number of the chemotherapies we use for breast cancer, although not all of them. Nausea is a common side effect consideration, although we have a lot of really good drugs for nausea now, so in general most people don't have a lot of trouble with nausea. Alteration of how your taste is, though, may still change how you enjoy meals, and these things are all temporary, so there's certain parts of the cycle again where you feel better and your taste buds are okay a lot of times. We do monitor blood counts. We know if patients' blood counts, say their white blood cell counts get low during a chemotherapy cycle, they may be at increased risk for infection, so we monitor for that closely. And there's some other less common side effects that we spend a lot of time talking about with patients as they're going through treatment, but these are not uniform and they're less common. The side effects of hormonal therapy are mostly based around the fact that a woman's body is sensing a different level of estrogen than it had previously, and so probably the most common side effect is hot flashes. Some people can note sleep disturbance or change in their sleep patterns. Some of the aromatase inhibitors can give people achy joints. Sometimes the majority of women don't really have a terrible amount of side effects with these, and in general they're pretty manageable.